Welcome to the hidden dangers of diabetes medications. While these drugs appear to work miracles for blood sugar and insulin, it's important to understand that they do have risks. We'll also discuss common warning signs to be aware of, tips to reduce side effects, and more. Plus, we'll show you how to get some excellent free resources because diabetes can be a confusing and lonely journey. So now more than ever, knowledge is power. Before we kick it off, it's important to say that you should never stop taking medication based on a YouTube video. Only ever do so with guidance from your healthcare provider. However, by the end of this video, you'll be better equipped to ask the right questions and give yourself a head start on getting your health under control. First up, metformin. Metformin is generally considered safe, but as with any drug, there are risks. Metformin suppresses glucose production in the liver, makes cells more sensitive to insulin, and reduces glucose absorption in the gut. Pretty impressive, right? But the thing is, metformin can cause serious trouble if you have kidney problems. Considering that an estimated 30 to 50% of type 2 diabetics have kidney disease, many without even knowing it, this is significant. One very serious side effect is lactic acidosis, where lactic acid builds up in the bloodstream faster than it can be removed. This causes muscle pain, trouble breathing, and extreme fatigue. If untreated, it can result in severe complications, including organ failure. For this reason, it's important to get kidney function tests before and during treatment. Vitamin B12 deficiency can also be an issue, so make sure you're getting plenty of B12. B12 mainly comes from meat, fish, eggs, and other animal products. Sure, you can find some B12 in mushrooms, marmite, and nutritional yeast, but not much. If you're concerned about B12, especially if you don't eat meat, ask your doctor for a comprehensive vitamin panel blood test. Likewise, it's best to limit alcohol, as this messes with both metformin and B12 absorption, and drink plenty of water each day, because metformin can be dehydrating. Metformin can interact diuretics, beta blockers, and ACE inhibitors, as well as common contraceptive pills, thyroid medications, and antipsychotics. So make sure your doctor is aware of all medications you take and read the leaflets yourself. After all, you want to know what you're putting in your body and catch anything your doctor might miss. If you experience symptoms like extreme tiredness, trouble breathing, stomach pain, or dizziness, don't ignore them. These could be warning signs of lactic acidosis or other serious side effects. Call the hospital immediately. And never try to drive yourself in an emergency medical situation. Call an ambulance or have someone else take you. Too often, people stubbornly try to drive themselves, but it's better to be safe than sorry, right? Number 2, Ozempic. Like metformin, Ozempic is relatively well tolerated compared to the drugs we'll discuss next, but still careful consideration is advised. First of all, Ozempic is a new drug, so while early studies show promising results, research is limited in regard to long-term use. The most serious concerns about Ozempic involve thyroid cancer and pancreatitis risk. Specifically, studies observed the development of thyroid tumors in rodents given semaglutide, the active ingredient in Ozempic. These findings have not been replicated in humans, however, research is ongoing. The latest guidelines recommend that people with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2 avoid Ozempic. Likewise, research suggests that semaglutide may increase the risk of pancreatitis, especially in those who consume excess alcohol, have high triglycerides, or have a genetic predisposition for pancreas issues. Ozempic works by mimicking a hormone called GLP-1, which is released in your intestines when you eat. This hormone tells your pancreas to release insulin, helping your body manage blood sugar levels more effectively. It also suppresses the release of glucagon from your liver, another way to keep your blood sugar in check. Furthermore, it also slows down how quickly your stomach empties, making you feel fuller for longer, reducing the desire to eat. Now, if you take Ozempic, it's incredibly important to take it slow with food and stay hydrated. That's because many people experience out of control burping, sudden diarrhea, and vomiting when they eat. Be especially careful with spicy, greasy, and fatty foods, as these tend to cause the worst reactions. Likewise, Ozempic can interact with other medications, enhancing the effects of insulin and sulfonylurea, leading to low blood sugar, as well as potentially causing adverse interactions with antidepressants, anticonvulsants, antipsychotics, diuretics, steroids, and birth control pills. Now, Ozempic burst on the scene like no other drug we've ever seen, and its weight loss effects combined with social media hype have led to global shortages and counterfeit Ozempic. Fake versions have been found in numerous countries, including the US, European Union, United Kingdom, and other regions, with health authorities warning that these counterfeit versions can be dangerous. So while Ozempic appears to be a relatively low risk for most people, it's important to understand the potential downsides, how to adjust your eating habits, interactions with medications, etc. And of course, make sure you're purchasing the real deal. Number 3, DPP-4 inhibitors. Dipeptidyl peptidase 4, or DPP-4 inhibitors work by increasing the amount of insulin produced by the body after meals, thus helping to reduce blood glucose. Common types include sitagliptin, saxagliptin, allagliptin, and linagliptin. Now, while DPP-4 inhibitors are designed to decrease the risk of heart attack and stroke in diabetics, studies have found that they may actually increase the risk of heart failure for some people. A meta-analysis of 9 diacetyls have revealed a whopping 15% increase in heart failure risk among patients using these drugs. Likewise, the SAVOR-TIMI-53 trial found that saxagliptin was associated with a 27% increase in hospitalizations for heart failure. Other common side effects include headaches, upper respiratory tract infections, and even in rare cases of acute pancreatitis. Experts suggest that DPP-4 inhibitors are generally considered safe for younger patients with healthy heart function. However, caution is advised for those at higher risk for cardiovascular disease, which is a large proportion of type 2 diabetics. If you fall into this category, it's worth having a frank conversation with your doctor about the potential risks and benefits of these medications. The truth is, drugs like this should only be a stopgap measure to artificially bring your insulin function and blood sugar under control while introducing lifestyle changes. Watch our other videos for more on that, and if you haven't already, click the subscribe button to see more diabetes fighting videos as we release them. Likewise, you might want to download our free diabetes fighting books, 10 incredible foods that reduce blood sugar, and amazing alternatives to rice, pasta, and bread. Plus, watch our full-length diabetes fighting documentary. This 56-minute documentary features leading diabetes research, doctors, and endocrinologists, and is packed with practical strategies that can make a huge difference. Just click the link in the description box or visit diabeticstalk.com for all of these free gifts. Okay, let's continue on with number 4. Common medicines that contain thiazolidinedione include rosiglitazone and pioglitazone. As you may know, insulin is the hormone that helps your cells absorb glucose from your blood. When you have type 2 diabetes, your cells resist insulin, leading to high blood sugar levels. Well, TZDs activate a protein called PPAR gamma, which helps your body use its own insulin more effectively. So TZDs work pretty well at artificially reversing insulin resistance. However, there are some serious side effects to be aware of. TZDs took a major reputation hit in 2007 when a study found that rosiglitazone might increase the risk of heart attacks. The FDA responded by placing a black box warning on the drug, and trust in TZDs plummeted. One of the most significant changes associated with TZDs is fluid retention. Likewise, in 2016, the FDA officially announced that pioglitazone medicine may increase the risk of bladder cancer. This follows clinical studies showing that more people who took pioglitazone for more than 1 year developed bladder cancer than people who did not. So if you're taking TZD, it's essential to have an open and honest conversation with your healthcare provider. Make sure they are aware of your complete medical history, especially any heart, liver, or kidney issues, as well as any history of cancer or diabetic eye disease. There may be a good reason why you've been prescribed this medication instead of another, but it's generally not a first option for most people. Be vigilant for warning signs like sudden weight gain, swelling, changes in vision, stomach pain, changes in urine color, or difficulty breathing. As always, don't hesitate to reach out to your doctor if something doesn't feel right. And remember that getting a second opinion is always an option if you're not getting the level of care that you deserve. And at number 5, we have sulfonylureas. Though sulfonylureas continue to be widely prescribed, their safety has been a contentious topic for nearly 50 years. Common types include glipizide, glyburide, and glyburide. You can spot them easily because they end in "ide." Sulfonylureas work by stimulating the pancreas to release more insulin, regardless of blood sugar levels. This helps diabetics better control their glucose, but it comes with risks. According to a 2023 update by the U.S. National Library of Medicine, the most pressing issue is hypoglycemia, or dangerously low blood sugar. This can lead to confusion, seizures, or even death if untreated. The FDA has given sulfonylureas a black box warning, their strictest alert, due to studies showing sulfonylureas may increase heart attack risk. So why are sulfonylureas still used? Essentially because they're cheap and broadly available, which for some governments and healthcare providers may outweigh the potential risks. Likewise, some people may not be able to afford better options in countries where drug prices aren't regulated. If you take a sulfonylurea, it's advisable to see if you can be switched, because there are many diabetes medications that do the same job with a lower risk profile. If not, be vigilant for warning signs like excessive sweating, dizziness, or heart palpitations. Make sure your doctor knows your full medical history, as these drugs can often clash with other common meds. And always keep glucose tablets on hand in case of hypoglycemic episodes. Finally, it's vital to recognize that while medications play a role, addressing lifestyle factors is vital, because even a 10% improvement in blood sugar control can significantly enhance your quality of life. For more on that, you might like to watch our video on 10 ways to reduce blood sugar in 1 week naturally. We'll leave a link to that in the description box or click the image on the screen.